My name is Sira Boats, and thank you for joining Boats Memory Method, where we're bringing you hope on the dementia journey. And today I'm going to talk about drugs and the impact on short term and long term memory. And I saw a very interesting article here recently put out by the AARP that really summarizes the impact of common drugs, prescription drugs, as well as over the counter drugs that impacts our memory. What I find so interesting, and that we don't commonly understand about brain health, is that as we age, our brain resources decline, meaning our neurotransmitters may not be as healthy as it used to be. The presence of hormones in our body has shifted, our nutrition changes, so our cell health is compromised, and that happens in the brain as well. Now, if you have long-term issues in the brain, such as inflammation, high stress, chronic conditions, then those situations will impact your cell health as well. We all have cell regeneration or cell neurogenesis, meaning we get new cells every day. As we age, we don't get as many as we used to. And if those cells die faster than they regenerate, we are stuck with neurocognitive decline. Something that accelerates this process are drugs, chemicals. So the presence of chemicals in our cells will accelerate cell death. And then when we have that neurocognitive decline, that's when we can get into a position of having some sort of dementia. And there's many types of dementia, and the causes are so varied. But one of the things that we can manage are drugs, chemicals. So let's look at some common drugs and chemicals that are out there that can impact our short and long-term memory. Now, for short-term memory, you need short-term working memory so that you can remember the code to your garage door so you can park your car. Well, you need that in the short term, but then it becomes a long-term memory over time because you need that every day. A better example is if I go into a building and I work there for the day and a bathroom has a passcode, I'm going to remember that passcode for that day in order for me to be able to use the bathroom. That is short-term working memory. When I'm done with that information, I will trash it because I'm not going to need it anytime soon. That is the difference between short-term working memory and long-term memory. So my garage code, I'm going to store as a long-term memory because I need that every single day. And because I use it every single day, it becomes an automatic response. But something that I just need in the short term for right now, that short-term working memory is something I can trash later because I'm not going to need it again. Now, these drugs can impact both your short-term working memory, meaning keeping a thought in your brain long enough to do its work for you, or the ability to store it so that you can get back to it at a later time. That's the difference between short and long-term memory. Now, these drugs may impact just short-term or just long-term, or they may impact both, which is worse. So let's look at it. And this is a very concise list, or actually it's a very concise summary, I should say, of the different types of medicines and drugs that we have access to as humans. So we have access to anti-anxiety drugs or benzodiazepines. Those drugs impact both short-term and long-term memory. Then there's antihistamines. Now, these are very commonly used, and when Benadryl is a very good example, available over the counter. It impacts short-term and long-term memory. Anti-seizure drugs impact short-term memory. So once you stop it, then you can start to regenerate your long-term memory again. Incontinence drugs does not impact short-term working memory, but it can impact long-term memory. In other words, I may be able to have enough short-term memory to do what I need to do in the moment, but I'm not able to convert that to long-term memories. Narcotic painkillers such as Opiates can cause short-term and long-term memory loss. Sleeping aids, short-term memory loss. And then there's the tricyclic antidepressants. That's the older class of depressions. The antidepressants, can cause you short-term and long-term memory loss. So let's look at some examples. For anti-anxiety drugs, benzodiazepines, they are used for agitation, seizures, deliriums, but they have a sedative effect. And some examples are Xanax, Klonopin, Valium, Ativan, Dorol, Restorol, and they dampen the activity in the key parts of the brain, including those involved in making short-term and long-term memories. Alternatives for these are benzodiazepines, number one, should not be prescribed for older adults. Only rarely should they be used, and only for a short period of time because of the impact on the brain. Older adults longer to process and metabolize these medicines. So some of the other alternatives can be non-drug treatments, and maybe something like cognitive behavioral therapy for insomnia or for anxiety, looking at breathing therapy, changing of our environment. But the drug option is really not good if we already have neurocognitive decline. Then there's anti-seizure drugs. They are prescribed typically for bipolar disorder, for nerve pain, mood disorders, and then mania. Mania is when you go into a very accelerated, energetic period of mental function beyond what's normal. So the examples for anti-seizure drugs are Tegretol, Neurontin. I see Neurontin used very commonly for pain, for nerve pain, for diabetic pain, Lamictal, Keppra, Trileptal, Lyrica. Lyrica is something else that gets very commonly used, especially in for orthopedic pain. Topamax is another one, Depakote, Dilantin. These medicines are anti-seizure medicines, limit seizures by dampening the flow of signals within the central nervous system. But because we are slowing the brain down, we are impacting memory, attention, and attention span, and we can have sleepiness from these medications. So there may not be medical alternatives, and if you are having life-threatening seizures, you may have to stay on these seizure medications. But it's a good idea to discuss with your physician what's the lowest effective dose that you could take, and if you're not taking it for seizures, but you may be taking it for pain or for nerve pain, is to discuss if there are alternative treatments for those kind of pain. And this is especially if you already have neurocognitive decline, because these medications will dampen whatever resources you have even more. Tricyclic antidepressants. They're prescribed for depression, anxiety disorders, obsessive disorders, nerve-related pain. Some examples are Elavil, Anafranil, Norpramin, Silanor, Tofranil, Pamelor. These antidepressants block the uptake of serotonin and norepinephrine and other chemical messengers in the brain, and therefore causes lapses in memory. So there are some newer antidepressants out there, such as Prozac, Zoloft. So these SSRIs don't have the same anticholinergic effects, meaning blocking the chemical messengers and blocking the ability to make memories. Narcotic painkillers, such as opioids, they are described for pain, and I think we are now in an age where we're looking at these kind of painkillers closer, and they may not be prescribed as commonly, but you need to know that things like Vicodin, Dilaudid, OxyContin, including tablets and transdermal patches and suppositories, all of these decreases the flow of pain signals within the central nervous system and blunts your emotional reaction to pain. And this is why it impacts short and long-term memory, because it impacts the ability to store memories because it's impacting that central nervous system flow. So alternatives here are non-steroidal anti-inflammatory drugs as a good alternative for these opioids, and we should really just be on any opioid for a very short period of time after acute incident, such as an acute injury or acute surgery. It should not be considered a long-term pain management option. And of course, acetaminophen such as Tylenol may be another option, but you have to consult with your physician because it can impact your organ health. Sleeping aids. These are your non-benzodiazepine sedative hypnotics. They're commonly called the Z drugs, and this is like your Lunesta, your Sonata, and your Ambien. Those are the drug names that you may know these drugs by. They are molecularly distinct from benzodiazepines, but they act in the same brain pathway. In other words, they block those chemical messengers in your brain that also helps to maintain and form new memories. So that's why it is impacting your memory. So here are the alternatives for treatments of insomnia and anxiety, such as melatonin. That's a very safe drug to take. Now, it doesn't always work for everyone, but there are combinations that you can use with other natural remedies, such as 5-HTP, L-theanine, and SAM-E. So a combination of melatonin with some of these other natural options can help you have a healthier sleep. Incontinence drugs, those anticholinergics, I would highly, highly recommend that you see an incontinence specialist and look at your bladder health options, at your bladder health environment, because a lot of times we can wean people off of incontinence drugs through bladder training and education. These anticholinergics, such as Enablix, Ditropan, Vesicare, Detrol, Sanctura, they are type of oxybutynin products, and some of these are sold over the counter, and they have complications in long-term memories. And they block the action of the acetylcholine in the brain, which helps with making new memories. So the impact on the memory and the learning center may be worse than the benefit that you're getting for your urinary health. So the first step is make sure that you're properly diagnosed. A lot of times medicine is prescribed before we really try to find out why someone is incontinent. In my practice, we have an incontinence management protocol and program, and we can get 95% of people continent without medication because of the way we structure the environment, how we educate them on hydration and nutrition and exercise, even pelvic floor exercise. So there is many alternatives rather than defaulting to a medication. Antihistamines, first generation antihistamines for relieving allergy symptoms. These can sometimes be used for motion sickness, nausea, and vomiting as well. Some examples are Demetane, chlortrimeton, Tavist, Benadryl, Phenergan, Vestaril, and these medications affect your memory because it affects the action of acetylcholine in the brain. And again, acetylcholine is that chemical messenger in the brain that helps with making memories. And if we suppress that, then we have a hard time making memories. So definitely we need to try to minimize the intake of antihistamines. Luckily, Claritin and Zyrtec these days are a newer choice of medications, and they're better tolerated, and they don't have the same impact on memory and cognition. Now, there are 3 more classes of medications that can impact your memory. Those are corticosteroids. So those are anti-inflammatory drugs. They sometimes have to be used when you have lung inflammations like asthma flare or bronchitis or infection. But again, this shouldn't be something that you stay on long term. Some patients with rheumatoid arthritis, lupus, and other conditions perhaps need to have this in order to suppress their autoimmune disease so that they can thrive. But those are the exceptions. For those of us that don't suffer from an autoimmune disease, we really should be using corticosteroids very sparingly. Then there's heartburn medication. There are very recent studies that shows that heartburn medicine used for GERD, heartburn, and peptic ulcers can increase the risk of dementia. So very important that you really consider what causes your heartburn. Can you change the way you sleep? Maybe elevate your bed at the headrest of your bed. Can you change your intake of foods towards the end of night and what you drink? So how can you manage your heartburn and your reflux in a more naturalistic way rather than medication? Last but not least, cannabinoids. Access to cannabis and drugs have grown, and there is a study in the American Journal of Psychiatry in 2022 that followed about 1,000 individuals and found that long-term cannabis users can have a decrease in their cognitive skills as well as memory and attention span. So cannabinoids can be very useful for sleep, for pain management. There's all kinds of benefits with cannabinoids, but I think it's very important that you consult with an expert that can help you define how much of the cannabinoids you need in order to manage your symptoms. So it can be a very healthy, natural pathway for managing some of your conditions, but we cannot use it in excess. There has to be boundaries there. So that is for you a little summary of 10 different kinds of drugs that's out there that can impact memory, the making of memory, short-term and long-term. So I would really advise you to go look at your medicine cabinet, look at the choices of drugs that you have, and have a conversation with your physician to see if maybe you can make some changes or get off of some of those drugs. Thank you for listening to us today. Please follow us on YouTube. Go to our website at www.boatsmemorymethod.com, sign up for our newsletter, and check out all the offerings that we have for professionals for continuing educational hours. And we'll see you later.